Well, now our original series, Project Home.
Our homeless shelters prepare to deal with mental health issues as well. One mother was kicked out of a shelter after her son had an outburst, and she hasn't seen him since.
Now, the shelter says that their hands were tied. Susie Steimle has the story.
I was told I had an hour to get all my belongings and to be out of here.
This is the first time Tanya Schwenk has been back to the Sunrise Village shelter. She and her 28-year-old son were kicked out of here at the beginning of October.
When I came here, I had so much hope, and when I left, I had none.
Tanya and her son lost their permanent home 2 years ago to an eviction. Since then, they've been couch surfing. It took 18 months to get off wait lists and into a shelter. They were here for 8 months, and then her son, who has mental health issues, had an outburst, and they ended up back on the street.
Why wouldn't you sit down and try to figure out how to help these people rather than throwing them both into the street with no services and no help?
And where's your son now?
He's wandering.
Tanya says after they were kicked out, her son took off. She hasn't seen him since October 1st.
But I haven't been there to make sure he takes his medication. So that's, that's an issue. I don't want him to get caught up in the mental health hospitals or jails from wandering around homeless.
Do you think they should have been better equipped to help somebody with mental health issues?
Absolutely.
There's got to be cases where this happens.
Yes.
Louis Shequin is the CEO of Abode Services, which operates Sunrise Village in Fremont. He says staff and other clients felt threatened by Tanya's son.
The distinction is we need to help you be the best you can be with your disability, but you can't cross these lines.
And those lines, one being putting others at risk?
Correct.
He says about once a month, something like this happens, and their hands are tied.
Basically, you have to manage it in a way that makes it acceptable for everyone, and sometimes it doesn't work.
I'm sure that's a tough choice.
It's very difficult.
Tanya and her son were offered permanent housing, but turned it down because she didn't think she could afford it long term.
It is sad to see people turn down options for housing. I'll say that of the frustration in this job, that's the hardest to take, actually.
And I said, no, I can't. Within 9 months, I'll be homeless again. Once it goes back up to the normal market rate, I will be going through this all over again, and I don't want to do that.
Louis says he sees this story as a failure of resources, an inadequate supply of housing options and shelter beds for those in crisis. Oftentimes the shelter is the end of the line, so he has nowhere to send people if they cannot stay. And the wait for another spot at another shelter is extremely long.
It's a lot of demand. So yeah, it can be easily up to 6 months before someone comes in.
So how do we do better for people in this situation?
Yeah, that's the million-dollar question. And it literally is a dollar question.
So after cycling through the system for 2 years, Tanya says she's worse off than where she started. She's running out of goodwill with friends and needs to bring her son home, even if that means sleeping on the street.
The weather's been getting colder, it's not summertime, but I am thinking about getting a tent and some sleeping bags so that me and my son can be, together, and I can watch over him even if we have to stay outside. I'd rather be outside with my son than not know where he is.
Tanya's decision to turn down housing is something that happens a lot more often than you might think. Someone in her position is often offered a housing subsidy that would last 6 months to a year. After that, she would be expected to be able to pay her own rent. Knowing that she couldn't do that was enough for Tanya to turn down multiple options. Susie Steimle, KPIX 5.
And this works because you're involved. So keep sending your stories and ideas to Project Home at CBS.com. And you can see all of Susie's reports